Hi, you're watching DNA Today, a multi-award winning genetics podcast where we explore everything to do with genetics, from CRISPR to rare diseases to new research. We have won the Science and Medicine Podcast Award for many years now. We have hundreds of episodes, and we really hope you enjoy these conversations where we dive into so many genetic concepts. I'm Kira Deneen, a certified genetic counselor, and your host.
Hello, my name is Miranda Di Biase. I am a pediatric genetic counselor, and I graduated from Sarah Lawrence, the genetic counseling program in 2020.
My name is Joy Lynn, and I'm currently a second-year genetic counseling student here at Sarah Lawrence.
My name is Claire Zimlinghaus, and I'm also a second-year student here at the Sarah Lawrence Genetic Counseling Program. Today, what we're going to be doing is a mock pediatric genetic counseling session to show you what that could look like in real practice.
This is a case that Claire and I created together.
So, hi guys, my name is Miranda. I'm a genetic counselor here at the hospital. What are your names?
My name is Claire.
My name is Joy.
Nice. And what brings you in today to this genetics appointment?
My son was recently diagnosed with autism, and they had some maybe concerns that this could potentially be something genetic.
Okay. And who referred your son to see us here today?
I believe it was a pediatrician.
A developmental pediatrician.
Yes.
Okay. And your son's name is John?
John, yes.
Okay. And what's your understanding or knowledge about autism? And it's okay if you can say Miranda, I haven't looked into it. I'm not quite sure. So it's completely fine to not have any answers
I did a little Google search after he was diagnosed, and I found there's just some differences in their behavior, maybe the way that they sense things, something like that.
Yeah, absolutely. And so, autism is like you mentioned, it's a difference in behavior and how an individual socializes with others. And for a majority of individuals that are diagnosed with autism, we still don't have a clear kind of explanation. We think it's probably a combination of both genetic factors and environmental factors. However, at this point in time, we do know that there's a number of neurodevelopmental genetic conditions where an individual can have differences with their development and also kind of this autistic behavior. And so, a lot of either pediatricians or developmental pediatricians or other specialists will refer children once they get a diagnosis of autism to try and see if that child is kind of in that slice of the pie, that they were born with a genetic condition that is causing these differences. Okay. And later on in the session, we'll kind of talk about what are some of the benefits to doing genetic testing and what information it can provide you about John. Usually how these sessions work is I'm going to start off by collecting some medical history, then we'll talk about family history, and then our geneticist will come in and do a physical exam of John. If there's any questions that you have during the session, please feel free to interrupt me. But before I start, any questions so far?
I don't think so. Yeah.
Okay. Who's John's mom?
I am.
Okay. Fair. Yeah. And Joy, how are you related to John?
I'm her sister-in-law. I'm just really close to John.
Okay.
And so I'm here for emotional support.
Awesome. Okay. We love that. Claire, going back to your pregnancy with John, when you were pregnant with John, did you have any problems with high blood pressure, any infections, any high blood sugar, any concerns during your pregnancy?
No, it was pretty easy.
Pretty easy. Awesome.
As far as pregnancies.
Yeah, for sure. For sure. And were you taking any medications during your pregnancy?
No, I don't believe so. I think they gave me prenatals.
Prenatal vitamins. And then during your pregnancy, Claire, was there any use of recreational drugs, alcohol, smoking, anything like that?
No.
Okay. And then any abnormal ultrasounds during your pregnancy that you can remember?
No, I don't believe so.
Everything was good.
Yes.
Awesome. And for any reason, did you do any genetic testing while you were pregnant with John?
I think they did some sort of screening. I think it was for Down syndrome, and everything was completely normal.
So it was a blood test on you. No one talked to you about doing any invasive diagnostic procedure, something where they'll put a needle through your belly called an amniocentesis, anything?
No.
Okay.
No.
It was just the blood screen.
Yes.
And then kind of going now towards like your delivery, was it like a full term pregnancy, 40 weeks, or did you deliver a little bit earlier?
No, he was full term. He
Okay.
was 40 weeks, a couple days maybe.
Okay. And was it a vaginal delivery or a C-section?
Vaginal.
Okay. And roughly how much did John weigh when he was born?
No, I believe he was about 8 pounds.
And my other question is, what was the hospital that he was born at?
He was born at Maimonides.
Okay. You're in New York.
Yes.
Okay. And when he was born, did he have to stay in the NICU for any reason?
No.
No, everything was good.
Yeah.
Okay. And did he pass, if I don't know if you remember this, but did he pass the newborn hearing screen when he was born?
Yes, yeah. His hearing was normal.
Okay. Great. So everything's been good. So the pregnancy was good, delivery was good. I want you to tell me, Claire, a little bit about when you first started to become concerned about John. Kind of like what age you noticed some differences and kind of talk more to me about that.
I don't quite remember the age. I just remember that a lot of the kids that we were kind of seeing, he was a bit behind them in terms of, sitting up by himself. I think when he first sat up, he was maybe 10 months or so.
Right.
And then,
He didn't start speaking until 3.
Okay. So there was like some developmental like delay that was noted for John. And what did his pediatrician say about that? Did she or he make any recommendations on him receiving any like therapies or?
yes, he goes to physical therapy and occupational therapy and speech therapy.
Okay. Did the pediatrician refer John to any sort of specialist when they were suspicious that he might have autism?
He went to see an audiologist just to check his hearing to rule that out
Okay.
as a potential reason for his speech delay.
Okay. And I'm assuming that his hearing exam was normal. They didn't notice any like hearing loss for John.
Yes.
Okay. Did John ever go to early intervention, which is kind of this program that we have in New York? Usually pediatricians, whenever they notice some developmental delay, they can refer the child to early intervention where they do a more thorough evaluation. Has that happened for John?
I think the pediatrician that diagnosed him did mention that. I think we were trying to work out the details about it before we kind of went through with it.
Okay.
We're hoping to get that done very soon.
Got it. And how old was John when he was diagnosed with autism? He's 4 now.
Yes, he was diagnosed, I think 6 months ago.
Okay, so like very recently.
Yeah.
So like around like closer to 4, like when he was 3.
3.5.
And if you don't mind me asking, why does he get physical therapy?
He just kind of has a little bit of issue walking. That was also a bit delayed for him. He didn't start walking until he was about 2.
Okay. And has there been improvement with the physical therapy?
Yes, he's gotten much more skilled at walking.
Okay. Is he able to climb stairs on his own?
Yes, every now and then it comes and goes, I guess.
Okay. With just talking about his motor skills, have you noticed any regressions? So an example is, sometimes children, they're able to walk, there's no problems, and then all of a sudden they start stumbling and they have frequent falls. Have you noticed any decline with his motor skills?
No decline, just, some slow progress.
Okay. And has he ever seen like a neurologist ever before? Like is there any concern of him having any like muscle problems and that's why he's having difficulty?
I think we did get a checkup by a neurologist and there was no concern for that.
And then you talked about OT speech. How many right now is John able to communicate with you in complete sentences or is he nonverbal? How does he communicate with you guys?
He speaks in short kind of sentences.
Okay.
2 to 3 word phrases.
When did that start? Like how old is he when he was able to kind of communicate with you guys using like putting 2 to 3 words together?
I think about when he was 2.5 towards 3-ish.
Okay. And so right now, if he like wants like milk or food, or he wants to show you like needs something, does he try to use words, or does he like bring you to what he needs? What's his like main form of communication with you guys?
Mostly words. Sometimes he'll that if he wants to show me something. Look, mama.
Okay. Okay, awesome. Other questions that I wanted to ask you guys. Has he ever had to stay overnight at the hospital for any reason?
Not overnight, no.
Okay. Is he taking any medications right now?
No, not right.
Has he ever had any surgeries before?
No surgeries.
Okay. And besides his pediatrician, he has his development pediatrician, and then obviously his therapist at the school for his therapies. Does he see any other specialties that I haven't asked about for any other medical concerns?
I mean, we've had to take him to an ear doctor a couple of times because he had some ear infection.
Okay, the recurrent ear infections.
Yes, I think he had an ear infection 3 times, maybe.
Yeah, that sounds right.
And I'm assuming this is like the ears, nose, and throat doctor?
Yes.
Do they still want to follow up with John, or do they say, John needs to come back only if he has another like ear infection?
I think they just say come back if he has symptoms of an ear infection.
Right. And so it seems like kind of overall with John, kind of like the main concerns is kind of like developmental delay in kind of multiple areas, but it seems like he's been improving, which is really great. And then kind of like the behavioral, his diagnosis of autism. Does he know the alphabet? ABCs? Does he know ABCs?
Yeah.
Okay.
Yep.
And like numbers, he knows, he can identify body parts.
Yes, for the most part.
Great. And in like his school, how many kids are roughly in his class?
I want to say about 20.
Okay. And so does he have like a does he have a separate teacher with him in the classroom, or is it just like one teacher and then he's taken out for like his therapies during the day? Do you know the setup? It's fine if you don't.
I think there are 2 teachers in the
Okay.
classroom, but he doesn't have a one-on-one.
Got it. Okay. And I know we already kind of brushed and discussed like developmental regression. And it seems with John, like you mentioned, like there's like just improvement. There's no kind of him having a bunch of words and then all of a sudden losing those words or nothing like that. Great. Now I just want to collect a quick family history. So besides John, Claire, do you have any other children?
Yes, I have a daughter.
A daughter. And how old is she?
She's 2.
Okay, 2. Her and John, do they share the same father or different?
Same father.
Okay. And for your daughter, Claire, any medical concerns you have for her?
Nope, she's pretty healthy.
Great. No concerns with the pediatrician that she has any developmental delay, and she's never had to see like early intervention, or she doesn't have a diagnosis of autism, nothing like
No,
that.
he said that she's on track.
Great. And then Claire, for yourself, do you have any history of miscarriages?
No.
Okay. And then Claire, starting with kind of your side of the family, starting for yourself, how old are you?
I'm 28.
Okay. And do you have any medical concerns that you've been dealing with for most of your life?
No.
Okay.
Nothing like that.
Kind of going back to school for you, was there ever a need for you to need any like special education or any therapies or any extra supports in school?
No. I just was in the classroom.
Awesome. Everything was good. And then Claire, do you have any brothers or sisters?
I have 2 sisters and 1 brother.
Okay. And do you all share the same mom and dad?
Yes.
And for your 2 sisters and brother, as far as you know, do any of them have any medical concerns that they've been dealing with since they were young?
Adam, he has asthma, but otherwise he's doing fine in terms of his health.
Okay. None of your siblings needed, again, like any extra help in school, any therapies, behavior, developmental concerns for them?
Nothing like that.
Okay. And do your siblings have children?
Yes, my brother has children with.
Okay. And sorry, Claire, just so I don't forget, going back to your sisters, do your sisters have any children?
Yes, one of my sisters has 2 boys and a girl.
Okay.
And then the other one doesn't have any children.
Okay. And your sister with the 2 boys and a girl, her 3 children, do they all share the same father?
Yes.
Okay. And then going back to your brother, Claire. So for you, your son and your daughter, how old are they?
7 and 6.
Okay. Your son's 7?
My son's 7.
Okay. Any health concerns for your children that you're aware about?
My daughter also has asthma, but
Okay.
otherwise, they're both healthy.
Okay. And then Claire, going to your parents, are they alive or have they passed away?
They're both alive.
Okay. Any concerns for your mom or dad that they've been dealing with since they were either children or young adults that you're aware about?
No, just, the typical age-related things.
Okay.
Like hypertension, I think.
High cholesterol,
Exactly.
all that stuff. Okay.
Right. But nothing since they were little.
Like young adults. Okay. And then Claire, where is your family originally from? Like your background, ethnicity?
We're Irish.
Okay. And then just to summarize for your side of the family, Clara, before I go to John's father's side, it seems like on your side of the family, there's no one with any diagnosis of autism, no developmental delay or intellectual disability.
Actually, my sister's son also has diagnosis of autism.
Okay.
No, I think he's 7 years old right now.
Mm-hmm.
Okay.
He was diagnosed when he was maybe 3.
He's 7. Does he get any special education in school?
Not that I'm aware of.
Okay. Does he get any therapies in school that you're aware about?
I think he gets
PT and OT.
Yeah, I believe so.
Do you roughly know how old he was when he started walking? Only asking because he's receiving PT.
I want to say he was maybe 1.5 or 2, somewhere around there.
And then what about speech? How old was he when he started saying his first words?
I don't quite remember.
Okay. Right now, when you see him, does he communicate using words?
Yes, there was no issue, I think, with his speech that we were told, my sister.
Okay.
Just mainly the walking.
Okay. And like the fine motor and gross motor.
Right.
Okay. Do you know who made the diagnosis of autism for him?
I think it was a pediatrician as well.
So like a pediatrician that specializes with development or just his like regular?
I think the specialized with development.
And then your sister's daughter and her other son, as far as you know, they're doing well. They're healthy. No concerns for them? Okay. Thank you so much for all that information. Now going to John's father's side of the family. How old is John's dad?
He's 28 as well.
Okay. As far as you know, any medical concerns for him that he's been dealing with since he was young?
No, he's been pretty healthy his whole life.
Okay. Do you know if John's dad has any other children with another partner?
No.
And does he have any brothers or sisters?
He has 1 brother and 1 sister.
Okay. And do they all share the same mom and dad?
Yes.
Okay. And for his brother and sister, any medical concerns that you're aware about for either of them?
No, they're pretty healthy as well.
And do they have children?
The brother, no. And then the sister has a boy and a girl.
Okay. And the boy and the girl, do they share the same father?
Yes.
Any medical concerns for his nephew or niece that you're aware about?
No, they're healthy kids.
And then his parents, are they alive or have they passed away?
They're alive.
Okay. Any medical concerns for either of them, again, that they've been dealing with since they were young?
Nothing since they were young. His mom had lung cancer
Okay.
last year, I think it was.
Okay. How old is his mom right now?
68.
And you might not know this information, Claire, but do you know if his mom is a smoker?
Yeah, she's a heavy smoker.
Okay. And what about his dad? Any concerns for his dad that you're aware about?
Nope, Stan's doing really well, actually.
Okay. And for his side of the family, where are they originally from, their background or ethnicity?
They're German.
Okay. And any chance, Claire, that you and John's dad are related, like from the same family?
No.
Okay. We always ask just because for some families it's part of their culture and it would make us focus on a certain group of genetic conditions. And then just quickly going back, Claire, to your nephew, a question just kind of popped into my head. Do you know if he's received any genetic tests?
I don't think he saw any genetics doctors yet.
Okay. And then, Claire, just a couple of other questions, and this is for both sides of the family, and just answer as best as you can. Anyone on either side of the family born with any birth defects? So they were born with extra fingers or born with a hole in the heart or like a cleft lip or palate, anything like that?
No, nothing like that.
Okay. And besides your nephew diagnosed with autism, anyone else in the family diagnosed with autism that we
No.
haven't talked about?
Just him and John.
Anyone on either side of the family diagnosed with like an intellectual disability, so it's difficult for them to hold a job or they need any like special education in school?
No.
Anyone in the family with any, who we haven't talked about, with any developmental delay, so it took them a longer time to walk, took them a longer time to talk?
No.
Anyone on either side of the family diagnosed with any vision loss or hearing loss in childhood, so deafness or blindness that you're aware of now? Anyone on either side of the family diagnosed with cancer under 50 years old?
No, not under 50.
Anyone besides John's grandmother on dad's side diagnosed with cancer? Anyone on either side of the family die unexpectedly? So they were healthy one day and then the next day just passed away for like no apparent reason?
No.
And then anyone in the family that you're aware about that's had 3 or more miscarriages or any like stillbirths?
No.
Okay, thank you for all of that information. So, kind of just quickly looking at the family history, kind of like the only big significance is, Claire, you having a nephew who was diagnosed with autism at around 3 years old. Is that correct?
Right. That's
Okay.
correct.
Awesome. So, we'll kind of take a pause right now. I'm going to go and I'm going to grab the geneticist and we'll review all this, and they will come in and do a physical exam, and then we'll
Okay.
talk to you more about genetic testing.
Okay. Thank you.
No problem. Okay, guys, so I just spoke with the geneticist. It seemed like John's physical exam was normal, which is really good. And now I kind of just want to talk to you guys about different genetic testing options that we can offer John today. So going back to the beginning of the session when we talked about genetic testing, I just want to kind of give you guys a brief overview of the benefits of genetic testing, because everyone coming into one of these appointments can have different thoughts or assumptions of what genetic testing can give them. Genetic testing, so one thing that it could do is really give you information that makes you better understand John. It gives you an explanation as to why he has these features. So that's like one factor that comes with genetic testing. Second thing is, if we do genetic testing and we find that John's features of like autistic behavior and his development differences is related to a genetic condition, we can also give you additional information on if there's any other health risks associated with that genetic condition that we need to be on the lookout for John as he grows and as he continues to get older. So an example is if we do this testing, we find an explanation for his features, but then we also find out that with this genetic condition, that individuals are at risk of developing seizures, right? So if we know about that, we can talk to you about like signs on what to look out for with that, right? So it allows you in a sense to be a little bit proactive, right? And for John's doctors to know what they should be on the lookout for every time they see John, okay? And then the third thing is family planning, right? If we find an explanation or an answer, that would give you information, Claire, on what's the chance of having another child with this genetic condition, right?
Okay.
The one thing that genetic testing can't do is that if we find an answer, an explanation, there's no way for us to fix or cure that, right? Because it's something that John was born with. It's in his DNA. So it's really just information for you, Claire, and for John's doctors. Okay. Now I'm going to talk to you more about what genetic testing looks at, different results. But before I do that, how does that sound to you? Like, what are your initial thoughts?
I think that sounds pretty good. We want to get, when his doctor said that he may have something genetic, that was a little concerning for us. So we wanted to, get as much information as we could, especially because I know you and Adam are thinking about having one more kid. So that would be useful for us to know. So hopefully that would be.
Yeah. And it seems like, Claire, just like hearing you speak, that like you are an individual that knowledge is power. And so the much information that you can gather about that is something that you want for yourself and for like your family.
Absolutely. Like you were saying, we wanted to be more proactive with his health, make sure that he can be as healthy as possible.
Okay. So we're going to talk more about different genetic testing options. And again, I want you to pick the option that best suits you and your family. Going a little bit back to biology. So all of us are made up of trillions of cells, right? In every cell of our body, we're born with our DNA, which is like this long strand that you see here. And our DNA is around 2 meters long. And I like to think of our DNA as our instruction manual. So it tells our body how to function and how to work for an entire life. We get half of our DNA from our mom and the other half from our dad. And as you can see here, kind of the DNA, how I picture it in my head, is kind of just like this strand of letters. Okay, so the letters go all throughout the DNA. And the letters, they come together to form what we call a gene. Okay. And we'll talk more about what a gene is. But before I do that, I just want to quickly mention chromosomes. So like I mentioned, the DNA, it's so long, it's 2 meters long, around that size. And so in order for it to fit into the cells, our DNA is packaged into these structures called chromosomes. And we have a total of 46 chromosomes. And so individuals sometimes can be born with small missing or extra pieces in their chromosomes. A missing piece we would call a deletion. An extra piece we would call like a duplication. And sometimes that can cause differences with development and behavior. Okay. Now, going back to genes, what a gene is. So I'm going to show you this picture. Because again, I'm a very visual person, so I think this helps explain what a gene is.
I'm also a very visual person, so this is very helpful.
Okay, great. So as you can see here, like the DNA is this long strand. Within our DNA, we have a bunch of genes, which I represent here with like rectangles. And so within our DNA, we have over 20,000 genes, a lot of genes. And for most genes, we get 2 copies of each. We get one from our mom and one from our dad. And so when you look at the gene, you can see that each gene has their own unique letter code. Okay. Every gene has their own job in the body. So in this picture, you can see gene number 2. This code gives instructions for how our brain grows and functions properly. We have some genes that give instructions for our muscles. And then sometimes we have a couple of genes that have a variety of roles in the body. So gene number 4, this code it's really important for how our heart works and functions and for our brain, right?
Okay.
Now, sometimes people can be born with spelling changes in their DNA. So what I mean by that is sometimes people can have a missing letter in a gene or an extra letter, or at a certain spot in the code of the gene where most people have the letter A, maybe someone has the letter C. Spelling changes can be quite normal, right? All of our DNAs are very similar, but we all have differences or spelling changes in our DNA that make us unique and different. So not every spelling change causes a problem. However, sometimes people can be born with spelling changes that causes the gene to not be able to do its job in the body, and as a result leads to medical problems and a genetic condition. So I know, Claire, I just gave you a lot of information. I want to give you the opportunity to, one, ask me any questions, but if there was anything that I was talking about that seemed a bit confusing, because I can definitely go over it.
No, I think it all made pretty good sense to me.
Okay. Great. That's always good to hear. The next thing I now want to talk to you about is looking at those spelling changes. What happens when a lab finds a spelling change and how they interpret the spelling change. Okay. So I'm going to go down to this picture. When labs are doing genetic testing and they are looking at a number of genes and they find a spelling change, there's a couple of different things that go through their head, different techniques and ways to understand the significance of that spelling change. So sometimes the lab, they find a spelling change and they classify it as like a non-harmful spelling change. We also call that like benign or likely benign. Usually they don't inform us about these spelling changes, but usually these types of spelling changes is just part of unique variation and isn't associated with genetic disease. Okay. Now, On the far end of that is when the lab finds a spelling change. They've either seen it before in other affected individuals in that gene. There's a good amount of information about that spelling change, and they know that that spelling change is harmful. And another word for that is pathogenic or likely pathogenic. When we find these spelling changes, this is what I'm looking for, and this what can eventually lead to a genetic diagnosis. Okay.
Okay.
And then right in the middle, sometimes we can find, well, not sometimes, a lot of the times actually, we can find these spelling changes where the lab, they're a bit unsure whether that spelling change is causing a problem in how the gene is working in the body, or if it's just part of unique variation, right?
Okay.
The spelling change makes someone different. Now, majority of the time, what we call variants of uncertain significance or inconclusive results, as we learn more about that spelling change over time, majority, they tend to be reclassified to likely benign, so not harmful. And because of that, never, unless we're really suspicious, we do not make a diagnosis or any management changes based on one of these types of results if we get an inconclusive result. So the first thing I want to ask you is, we have a couple of different options on how we can do genetic testing for John. The first option is starting very basic, that will look at just his chromosomes. So it would look at all 46 chromosomes, and it would look for any small missing or pieces in the chromosomes.
Okay.
And along that, add on an additional genetic test that has its own testing methods, which is why it's separate, and it's very specific for a genetic condition called Fragile X syndrome.
Okay.
Fragile X syndrome is a neurodevelopmental condition that we commonly see in males. However, females can have some development differences. The main features are developmental concerns, autistic behavior, and like intellectual disability. And so usually for any male that has a diagnosis of autism, we always recommend this genetic test to make sure that we're not missing anything. So that's one option. And if all that testing comes back normal, meaning that we don't find an explanation for the features that we're seeing in John, I would then recommend broader testing. And broader testing would look at the majority of John's genes in his DNA. The second option would just be to start off with the broader testing. It would look at all of his chromosomes and will also incorporate Fragile X testing. Now, the main difference is those variants of uncertain significance. As you might imagine, when you're looking at much more, the chances of getting one of these uncertain results goes up, right?
Sure.
So for some individuals, if, the idea of getting one of these inconclusive findings provokes a lot of anxiety, sometimes they might want to start off small and work their way up to broader testing.
Okay.
I don't know if you have a preference on doing it stepwise or doing the testing all at once for John.
I mean, I think we really wanted as much information as we could get. With the unclear results, you said it wouldn't really change what he's doing at this point, right?
Yeah.
So I think that's not, wouldn't be ideal to get one of those, but it's not a huge concern. So I think we could just do it all at once.
Now what I'm going to do, Claire, is just now go into more detail about that broad testing.
Okay.
And there's a couple more questions I'll be asking of you.
Okay.
The name of it is called genome sequencing. And basically what genome sequencing is like I mentioned before, within our DNA, we have over 20,000 genes. And so genome sequencing is going to look at, the majority of all of John's genes that we know today are associated with a genetic disease. And genome sequencing is also able to look at the chromosomes. And now with, how advanced it is, it can also look at Fragile X syndrome as well. Now, I kind of want to go step by step on the different results that can come back with genome sequencing, okay? So the first result is a positive result. So what does that mean? So a positive result means that we did this testing and either in a gene or in a chromosome, find a difference that gives us a genetic explanation for the features that we're seeing in John. So it gives us an explanation for his development differences and his autistic behavior. Okay. Now, with this testing, genome sequencing, as I mentioned, it's looking at a lot, right? It's looking at a majority of John's DNA. Help us understand the results a bit better. It's always recommended for at least one parent to provide a sample for this test.
Okay.
Of course, it's better if both parents provide a sample. And so if any positive result comes back if both parents provide a sample, it will give us information on whether that specific genetic finding or findings was inherited from one parent, if it was inherited from both parents, or if it's something that is completely new in John. Okay. And so that can help with family planning. We would also probably recommend for your nephew to be tested. And this is information for other family members as well. Okay. Now, when we get a positive result, how that discussion would look like is I would discuss with you the name of the gene, because they all have different names, discuss which gene is affected, or if it's a chromosome, which chromosome is affected, the name of the genetic condition that John was born with and that he has, what it explains about John, and again, if there's any other health risks associated with that genetic condition that we need to manage and be on the lookout for. Okay. Any questions about what a positive result means from either you, Joy, or Claire?
So if John gets a positive result, would my husband also need testing?
That's a great question. So it really depends on the genetic condition, because every genetic condition can have different forms of inheritance. So once we get that positive results back and we know how it's inherited, then we would relook at the pedigree and see, okay, now that we have this information, who is at risk of being a carrier or having this condition that we want to test.
So if it's a positive, my nephew should also get tested because it might be the same?
Yes. One thing that we could do is test your sister.
Okay.
Because that, when we're looking at inheritance, the only way for your nephew to have the same genetic condition as John is if it's something that you inherited or you have and something that like your sister has. We probably would first test your sister.
Okay.
And if your sister has it, then we would probably test all of her children, including your nephew.
That makes a lot of sense.
Great questions. Any other question about a positive result? No? Second result is what we call a negative result. And so what that means is that we do all of this testing and we come back with no genetic explanation or etiology for the differences that we're seeing with John. And so in that case, it wouldn't change any of his management. John should continue to receive all of his therapies to be the best version of himself and to continue to improve. The other thing is that this would not mean that he does not have a diagnosis of autism. Autism is a diagnosis that is made by either a developmental pediatrician, psychologist, and so that diagnosis doesn't change for John. But what a negative means is that at this point in time, we don't have an answer as to why he has these features. Okay. And because genetics is a field where every single year we discover new genes, our testing gets way better, I would recommend John to maybe follow up with us in 1 to 2 years, just to see if at that point there's any updated genetic testing that we could offer you guys. Okay. Of course, that being said, if John's development gets worse, there's a noticeable decline. If any new medical problems come up for John, if there's any changes in the family history, definitely follow up with genetics sooner, just because that extra information might make us think of a genetic condition that maybe we did not look at this time. So definitely let us know and we can update the testing that has been done. Okay. Any questions about the significance of like a negative result?
So if he comes back and the testing is all negative, That means there's no real genetic explanation for it. Does that mean that it was something we did that caused his autism?
Great question, Claire. So first thing I want to address there is that there is nothing that you did or didn't do that led to this, okay? If it comes back completely negative and a question that you have in your mind is, what's the chance of me having another child with autism? Even if this testing is completely normal, there's always a risk to have another child with autism. And I would definitely recommend for you to get a lot more of that information from a prenatal genetic counselor,
Okay.
who is much more expert in like the recurrence rates for that.
Okay.
The other thing that you raised a really good question is, if this comes back negative, does that mean it's not genetic? No. So kind of going back to that comment I made where genetics is a field where every single year we learn more. So it's possible that John does have a problem in a gene that at this point in time we just haven't discovered yet. Okay. And so it's possible that in the future, as we learn more about our genome, the DNA, and we discover new genes, that eventually, if we update his testing in 2 years, 3 years, 5 years, a genetic explanation can come up at that time.
Okay.
So negative does not mean that it's not genetic.
Okay.
It just means that at this point in time, we still don't have an explanation.
Got it.
But that's a good question.
That makes sense. Okay. Thank you.
The other result that I want to talk to you about, Claire, which I know we've already kind of briefly discussed, are those like variants of uncertain significance, inconclusive results. So again, if we get one of those results back for John, these results, they're super common when we do genetic testing. As we learn more about them over time, majority tend to be reclassified to not harmful or likely benign. If you and John's father do provide a sample for this testing, they will let us know if any of these inconclusive results come back, if it was something that was inherited from you or dad. Okay. And that just really helps us interpret the inconclusive results a bit better. But usually most of the time, unless we're super suspicious that this might be the cause for what we're seeing in John, it does not lead to a genetic diagnosis for John. It would not impact any of his management. I usually look at these results as they're innocent until proven guilty. Okay. So we monitor them over time. Every maybe year when you check in with us, we can see if there's been any updates on those inconclusive findings.
That makes sense.
The last potential result, it's super rare when we do this testing, but I always like to mention it. It's what we call an incidental finding. And so basically what that means is that the lab, we're looking at all of John's DNA, and we find that John does have a genetic condition, but it's completely unrelated to his development differences or his autistic behavior. It's something that we just bumped into and the lab informed us about. Now, the reason why I say it's very rare for this to come back is because how genome sequencing works is I provide the lab basically a complete summary of John, all of his current medical concerns, and really the lab should only report back to me anything that they find that is relevant to those concerns that they think might be causing them. Of course, I'm not at the lab. I'm not watching over there. So they might report back to me something that I was like, wait, like, why are you reporting this? How is this related to John's symptoms? So this is why I always like to mention it as a very small possibility.
Okay.
Okay. And again, if both you and dad are providing a sample for this test, they're not going to do this test separately on the two of you. How it works is if any positive result comes back, if any VUS or variant of uncertain significance comes back, if they report any incidental finding, they will let us know on John's report whether it was something that was maternally inherited, paternally inherited, or something that's new in John, which we call de novo.
Okay.
Okay. If this is something that is inherited from a parent, there might be some management or implications for that parent's health. And so we would go more into detail about what we would recommend for the parent, if they should have their own genetics appointment to go over their management if they need a CME specialist.
Okay.
Okay. Any questions about that?
No. Just a quick question. Is this a blood draw?
So that's a great question. So for John, we'll do a blood draw. But for Claire and like for Dad, we probably will do a buccal swab, which is just like a cheek swab.
Okay.
Just to avoid the small possibility that you and Dad, if you go to phlebotomy here, you might get billed for it.
Okay.
Because this is all one test, but the nurse might get a bit confused. So we'll do the buccal swab. If for some reason it fails and the lab wasn't able to collect like enough DNA, we can always either have a blood draw or have them mail you another kit to collect another sample.
Okay.
Okay. Though one other thing I want to talk about with this test, Claire, if both you and Dad provide a sample for this test, there is the possibility that the lab can inform us if people are related. So if there's any consanguinity or not related. So if there's any non-paternity. I always like to be open about that and just be very transparent with families.
So non-paternity, like either one of us is not
That like
John.
that John's like father is not his biological father.
Oh, okay.
Any questions about what we've just talked about so far?
No, I don't think so.
Okay. I know it's a lot of information. The last thing I want to talk to you is something that is completely optional. So you can say yes to this or no, it's not going to affect this testing. I like to think of it as kind of like extra genetic kind of information. It's called secondary findings. It's a list of around 80 genes right now. And these genes are all genes that we have in our DNA. But when someone is born with a problem in one of these genes, it can put them at an increased risk to develop certain genetic conditions that tend to show up in adulthood. So a majority of them are hereditary cancer conditions that an individual is born with, and it can put them at an increased risk to develop certain cancers like 20s, 30s, 40s, and also hereditary kind of heart conditions, cardiomyopathies, arrhythmias, okay? And so a group of doctors, they said, if a family is already being offered this really big genetic test, it's looking at the majority of the DNA, they should have the opportunity to learn about this extra genetic condition. It is unrelated to why Jean was referred to genetics in the first place. But if someone is found to have one of these genetic conditions on this list, we know a lot about these conditions already that they're all medically actionable. So an example is if someone finds out they have a hereditary cancer condition that puts them at an increased risk to develop, let's say, colon cancer in their these, they can do something about it. If they have that information, they can have colonoscopies more regularly. Colonoscopies can start earlier, right? So it allows them to be proactive. Same with some of these hereditary heart conditions. If you know you have an increased risk compared to the general population to develop one of these cardiomyopathy or arrhythmia, then you can have them see a cardiologist sooner who can monitor that. The only kind of asterisk or risk that I put whenever you are learning or whenever you're looking for genetic conditions that haven't developed yet, so symptoms haven't come up, there could be some issues in the future when it comes to applying for certain insurances. So specifically life insurance, long-term care insurance, and disability insurance. An example I give, let's say for life insurance, let's say someone does this test, they say yes to secondary findings, and they find out that they have an increased risk to develop, let's go back to colon cancer. And now let's say they want to apply for life insurance and they start applying for life insurance. The life insurance company asks for the medical history and they see this person has this increased risk to develop colon cancer in their 40s. They can deny life insurance or increase your premium rates. So for those insurances, there's no current protections when it comes to genetic discrimination. There is a law in place called GINA. It came to action back in 2008, and it's a law that protects with health insurance. So a health insurance company cannot deny you health insurance or increase your rates. And it also adds protection for employers. So an employer cannot use your genetic information to deny you a job or a promotion. However, for certain jobs, if it's under a certain number of people, I believe it's either like 15, or if it's with military service, this law doesn't protect with those. But for those other three insurances, there's currently no protection as of now.
Okay.
So some parents say to me, you know what, Miranda? I want all the information. We'll cross that bridge when we get to it with those three insurances. I want to know this because it's going to help my child be proactive in the future. Other parents say to me, you know what? This is already a lot right now. I just want to find an answer for the current medical concerns my kid has. And if in the future stuff comes up with the family history, we want to look more into that, we can do that testing at another time. So it's kind of really up to the family on how much information they want, and also if they're ready to gather that information at this point in time.
I think we definitely wanted as much information as possible, like you said, to be proactive, but I mean, the conditions you said aren't really onset until he's older, and I mean, making it more difficult for him to get those insurances. I don't want to do that to him. Is there a way that we can take a little bit of time to think about it and talk about it a little bit more?
Yeah, for sure. I will give you a form. I'm going to print out the form that one of the labs has. It kind of goes into more information about secondary findings. So you can take that home, Claire, talk more with John's dad, and I will call you maybe in the next 2 days just to get a confirmation on whether or not you want this extra information for John. For now, I'll just put no to be on the safe side.
Okay.
And then I can always update it and inform the lab that you changed your mind, in 2 days' time.
Okay, that sounds good. Thank
Okay. So, Claire, I know we've had a lot of information in this session. Do you have any questions about genome sequencing or the types of results that can come back?
I think you covered everything that I was wondering, so no questions.
Okay. Are you comfortable with providing a sample for this testing?
Yes.
Okay. And then for John's dad, just because as you already see, there's so much information and a lot of consenting, I just want to make sure that he gives verbal consent over the phone that he is fine to provide a sample and knows kind of the implications, the results that can come back. So I will give him a call maybe tomorrow or the next day. You can just let him know so he can be on the lookout for my number.
Okay.
Okay. But I will take a sheath swab from you and we'll have John do the blood draw right now. These results will take around anywhere between 8 to 12 weeks.
Oh, okay.
So what we're going to do is before you leave the hospital today, we can make a follow-up appointment. You could just make it at the front desk to see me again in around, let's say, 12 weeks to review the results.
Okay.
Okay. Does that sound good? And I'll just write out a summary that includes all my contact information. So if you go home and have more questions, I know I'm going to call you in 2 days, but you can always just send me an email or give me a call.
That works great. Thank you so much.
Thanks for watching DNA Today. To access all of our episodes, head over to dnatoday.com. We also have a lot of bonus content on there that you can enjoy. If you have any questions, comments, suggestions, guest pitches, you name it, send them in to info@dnatoday.com. We'd also really appreciate if you could take a moment to rate and review the podcast on Apple, Spotify, wherever you listen to the show. It really helps more nerds like yourself find the show. Also, if you like giveaways and other ways to connect with us, I recommend following us on social. We're at DNA Today Podcast. We also have a Patreon if you want to be the most level involved in the show. That's also at DNA Today Podcast. Thank you so much for listening and watching. Join us next time to learn and discover new advances in the world of genetics.